Hi, I'm Glenn. Follow along with me on my journey to Medicare. What is Medicare?
Medicare is a national insurance program administered by the federal government that guarantees access to health insurance for Americans aged 65 and older, younger people with disabilities, and people with end-stage renal disease. Medicare has deductibles and co-insurance, the parts you must pay, which generally go up each January. There are 4 parts to Medicare, which each cover different areas. The first is Part A. Part A covers hospital stays, home health, hospice, and skilled nursing care, and typically, there is no cost to you. Next is Part B, which covers doctor visits and outpatient services where the cost is set by the government and varies year to year. For Medicare Part B, a monthly premium will be deducted automatically from your monthly Social Security check. The Medicare Part B late enrollment penalty adds 10% to your Medicare Part B premium for each full year that you could have signed up for Part B, but didn't. The penalty is permanent. You'll pay the extra amount for as long as you have Medicare Part B. If you are currently not receiving Social Security benefits, you will get a quarterly statement. If you plan to enroll in any Medicare Advantage or Medicare Supplement plan, you must keep Part B. However, if you're still employed and have health coverage through your employer or have coverage with your working spouse's employer, you can delay enrolling in Part B without a penalty. If you have a higher income, you may have to pay the income-related monthly adjusted amount. This applies to both Part B and D. Next is Medicare Part C, otherwise known as Medicare Advantage. Medicare Advantage plans cover both Parts A, B, and usually Part D, along with some additional services. You must also be enrolled in Parts A and B to be eligible for Part C. Check your service area for available plan options. Monthly premiums for these plans can start as low as $0. Finally, Medicare Part D covers prescription drugs only, which can be purchased as a standalone prescription drug plan or as part of Medicare Advantage plans. You must also be enrolled in Parts A and B.
What is a standalone prescription drug plan?
Great question. A standalone prescription drug plan is a plan that can be purchased through private insurance companies already approved by Medicare. These plans work alongside and cover original Medicare Part A and Part B. Some Part C plans come with prescription drug coverage, so you don't need an additional prescription drug plan or Part D.
Be sure to follow along with me on my journey to Medicare. For more information, visit networkhealth.com/join Glenn or call 844-713-3311.